We're going beyond the headlines now with special assignment and a different kind of medical mystery. If you've seen the Fox drama House, you know doctors, real and imagined, struggle to diagnose illnesses.
But sometimes the mystery isn't finding the problem, it's figuring out how to treat it. Well, Fox 61 sports producer Tim Lammers faced this problem earlier this year, and he is here now with his story. Tim.
Brent and Susan, it's been a long road since I was diagnosed with a degenerative condition in my hips. That road ended in the operating room, so just a warning, if you're a little squeamish, this story may not be for you. I searched high and low, up and down for treatments, and as it turned out, the answers were right inside me all along.
On July 16th, I found myself in a position I never would have imagined. Flat on my back, drugged up, and facing a surgery we hoped would save my right hip.
If I was a horse, they'd have put me down by now.
I was 32 going on 70, which especially stunk considering where I was just 4 months before.
At the gym, 3 times a week. Like a lot of people my age, I was finally taking charge of my health. Because, like a lot of people my age, I had spent the years after college acting like I was still in college.
Great breakfast.
All those years with a healthy body, and the closest I came to breaking a sweat was playing golf. But by February, I was in the best shape of my life, with one exception. My right hip kept hurting after workouts. When my chiropractor couldn't fix it, she ordered an MRI.
I didn't like the range of motion in your hip. I was thinking possibly that you had early arthritis in your hip.
The diagnosis was far worse, a condition called avascular necrosis, or AVN, and it was in both of my hips, attacking the heads of my femurs.
What that means is that because of an impaired blood supply to a part of his hip joint, the bone in that part of the hip joint dies, and that leads to pain and eventually collapse of part of the hip joint.
The disease was more advanced on my right side, where an MRI showed the bone may have already started to crack. I was reduced to limping around and taking it easy going up the stairs. And now the only sport I could play was golf. That's fabulous. What's worse, I couldn't find any consensus on how to treat this condition. One orthopedist said nothing could be done. Another said nothing should be done. There's a small chance the AVN would go away on its own. But if it doesn't...
The other kind of scenario is do a total hip replacement.
Now, don't get me wrong, hip replacements are safe, they're wonderful medical advances, but the problem is they don't last forever, and there's no guarantee that your body can keep accepting them. And if that happens, then what?
I remember saying to you, Tim, that you are going to know a lot more about this disease than I know, that your primary care doctor knows, that most orthopedists know.
I needed better answers, so I searched the internet for hours a day. And eventually, I found another option. Dr. Thomas Einhorn of the Boston Medical Center.
Mr. Lammers is the third person that I've operated on who has come to me through the finding this opportunity on the internet.
Dr. Einhorn is using stem cells to try to regrow bone. It sounds controversial, thanks to the debate surrounding embryonic stem cells, which are so young and malleable that
it could form potentially a new person. That's what the concern is, that we're going to start cloning new people.
But stem cells don't need to come from embryos.
These are adult stem cells.
My stem cells. It's a transplant from me to me.
Adult stem cells are at the other end of the spectrum. They have already committed to only being able to make one tissue or a couple of tissues that are closely related.
The procedure is still relatively new, and there was no guarantee it would work. But it was the best option I had. So photographer Freddie Mathis and I went to Boston.
The operation we did was to actually drill into the area, bring ourselves right into the place where the dead bone is, and then by taking bone marrow from his pelvis, passing it off the table to a machine where it's concentrated, and then once we've drilled into this area, inject it right into this area.
The doctors started with a half-inch incision near the top of my pelvis. There, they removed several syringes of bone marrow.
We've harvested the bone marrow stem cells. They're going to be placed in this device over here, and they're going to be concentrated.
Doctors made another small incision on my thigh. Then they used an x-ray to start drilling a path right into my thigh bone.
This is about, drop your hand, somewhere between 10 and 12 case that I've done. Each time we do this, we get better at it. X-ray? Okay, drill that. What do you think?
We separated the red blood cells, which are here, the stem cells, which are here, and this is the plasma.
Okay, we're ready to do the stem cell injection.
That's right.
Our needle is right into the area where we want to treat the condition. Goes in very easily. Good. Done? Yeah, we're done.
The whole procedure took just a couple of hours.
Say hello to the camera. One thumb up.
I still want Mr. Lammers only to put weight on his hip after about 6 weeks, but I'm not even sure if that's necessary.
And after all that, check this out. Only 2 really small incisions, and I was just on crutches for a couple of weeks.
Thus far, I've done about a dozen cases, and thus far everybody's doing well. And so I'm cautiously optimistic that we're doing good for people, but I'll feel a lot more confident in that statement in another 18 months.
Well, I am very lucky to say so far so good. I go back for my next checkup in January, although it may take up to 2 years for us to really see just how well this worked, if it worked as well as we wanted it to.
Well, Tim, you are extremely well-versed, obviously, in what you were diagnosed with, and I really have to give it to you for being your own medical advocate and going after a solution when the medical professionals were telling you right now there wasn't one.
That's what I hear. A lot of people say when you wind up with a relatively rare condition, there's not a standard course of treatment. You have to be your own best advocate. So I was just doing it out of necessity.
And you didn't have a lot of pain in recovery. You just told us that you were putting weight on it. You weren't supposed to be, but putting weight on it the very next day.
I don't like crutches too much.
All right.
Yeah,
we wish you the very best. I hope that
Thank you so much. Thank you so much. And one last thing, if you want to find out more about it, you can go online to fox61.com. Have some links there for you also.
Good stuff.
Thanks, Tim.
Coming up.